All right, so let's
Yes.
talk about the a need. So why did we need our own? Why did we want to make our own mosque or our own brick? Why there was a need of Canadian position statement if we already have Dar statements? So so the author actually come up with 7 reasons why we have to came up with our own. So the first of all was that the Muslim population that are coming to Canada, they are from different countries and different culture. So they're not from one region. Also, the hour of fasting varies in Canada, right? So Toronto being the shortest, sometime the north, it's higher. So so dawn to dusk time can vary from winter to summer, as well as if the day length varies by latitude, the fasting hour significantly increases and decreases, while we being the very luckiest, Toronto will always get the short hours, right? So we know for the next 6 years, inshallah, 2024, at least we know that we will have more than 16 hours to fast. So at least for 6, 7 time years, the same regime is happening. So we need to know what needs to be done because the hours of fast are longer. Interestingly, this is something I came across with Al Jazeera website. So we know that Ramadan cycle repeats every. I was told 30 years, but it's 33 years. So I remember my mom used to say, I remember way ago Ramadan used to be there. So I remember when I immigrated to Canada, it was Ramadan used to be in September. So most of you will know when they do. So every 33 years. So if you kindly divide it, we would be spending at least 8 years per season. 8 years per season. So if it's winter, then at least 8 years in winters, 8 years summer, fall. And now, so the next April 2nd, Ramadan, we are looking into 2054, right? So this is very important to know because the learning that we will learn will actually exist with us for next 8 years, right? So the other most important thing that the work hours are different because most of the countries that people are coming in the Muslim country, they usually get lunch break or they get or they split their work. Unfortunately, in Canada, it's not there. So the fasting will become tougher for these people, and the new immigrants, the people who are making Canada home, they have a poor family support. So that is another limit. Of course, the pharmacology back home and here are totally different. So the lot of views are in sulfonylurea. So the guideline, the DAR guidelines talk a lot about sulfonylurea, TZPs, NPH, regular insulin. While in Canada we use different pharmacology, as well as even our glucose monitoring is different. They emphasize more on POCs, while we have flash and continuous. And in the last, we know that when the number of hours of fast will increase, the risk of fasting, the risk of complications during fast will increase. So most of us are well aware with the risks, right? So that is why the Canadian endocrinologists thought that it is very important that they cannot put the guidelines just customized. They have to make a customized guidelines to Canada. So what do you think will be the risks mostly involved? With if diabetic who will fast. So we know hypoglycemia, hypovolemia, comas. What else that we don't think of? Right? So hyperglycemia, all these DKAs, hypovolemia. And did anyone know about thrombosis?
Acute kidney.
Yeah, acute kidney failure, acute illnesses. Yes. Actually, wait.
Not thrombosis.
So if it's a poor diabetic control, lots of fast breaking, then actually diabetic will gain more weight in Ramadan. And of course, sleep deprivation will also make other conditions worse. And the worst part is this: the guilt, shame, and the mood disorders that the person will get if they're breaking the fast or they're not getting this education is huge. So this is actually we know that in 2019, the Diabetic Canada came up with its own guideline, and followed by 6 months, they actually put a supplement paper where they actually came up with this guideline of prevention and management of diabetes in Ramadan.